Today, we're going to talk about the pros and the cons of extending your eyelashes and eyebrows. Yeah, there's some positives and negatives associated with allowing the eyelashes to grow longer or applying artificial means to extend those eyelashes. But there's also some positives as well, which we're going to discuss further. For those who are new to my channel, I'm Dr. Joel Kopelman. I'm a facial plastic surgeon, and I'm going to give you a lot of insight into this topic. There are both cosmetic and medical reasons why a person may decide to extend their eyelashes or eyebrows. First, let's talk about the cosmetic reasons. Obviously, when you extend your eyelashes, you look a little more glamorous, a little more sexually appealing, and some people want to look more alluring, so they want to stimulate those eyelashes to be longer. And that's been a common theme for thousands of years, actually. The way it's done typically is that people either use paste-on eyelashes, which you're all familiar with, and I'm going to talk about the negatives of using that. And the other way that's more current has been to use topical stimulants for your eyelashes. Those have pros and cons as well. Formerly, I thought that putting these drops on the eyelashes to allow them to grow longer was totally innocuous and didn't have any bad side effects. However, delving into the literature, I found that some of these drops actually can be harmful. So let's talk about how they can be harmful. Many of you are familiar with the brand name Latisse, which is actually a drug generically called bromatoprost, which happened to be a glaucoma medication. It was found that when people were treated with bromatoprost for glaucoma, they found that their eyelashes actually grew. And lo and behold, they found a new way to stimulate eyelashes. For the past 10 years or so, bromatoprost or Latisse has been used by applying the drops to the base of the eyelashes. Over several weeks, the eyelashes will progressively grow longer. And of course, this is a very desirable outcome because people want to have long eyelashes, particularly women. What they found, however, is that patients who have glaucoma, who apply the bromatoprost to their eye itself, have found that there's actually shrinkage of the fat around their eyes, and their eyes actually look deeper. So the superior sulcus up here becomes deeper. Some people actually get eyelid ptosis, and some people find that their lower eyelids, where they may have bulging fat, actually shrink. Some people think that's a positive thing that can occur, but the bromatoprost or Latisse can actually make the eye look sunken in. Now, that's for a patient with glaucoma. It's not clear from the literature how often these bad side effects can occur for people who apply it just to the base of the eyelashes. We do know, however, that people who apply the drop to the base of their eyelashes who have blue irises or green irises, over time, that color of their iris can change to brown. So that's something to be considered when thinking about using Latisse or bromatoprost on your eyelashes. The sunken appearance is reversible. However, when the iris of your eye changes from blue to brown, it can be permanent. So some people who have deep set eyes to begin with actually may have their eye appear even deeper set over time from the use of this topical drop. So that's something to consider before you just start with these eye drops that stimulate eyelashes. Now, I know there are several different products on the market that are commercially available, not the ones that are by prescription, which is bromatoprost. The other drops also can have an effect on the fat and the color of your eye. We're not sure what all these other drugs are actually doing. We know that the bromatoprost has an effect on prostaglandins. Prostaglandins is a molecule, a lipid, which has a stimulatory effect on the melanocytes, the brown cells around the hair follicle, which can darken the skin, by the way, as well. Not only the iris, but the eyelid skin can become darker. We know that these other commercially available eyelash stimulants can also have similar side effects. So we have to be very cautious and think about the possible consequences of using these eyelash stimulants over a long period of time, because they may have some negative cosmetic effects that are undesirable. So like anything in life, there's always a risk-benefit ratio, okay? Yes, you want longer eyelashes that make you look more beautiful or more sexy. However, there may be some consequences, and you have to consider that. Usually these things occur after using these drops for several months or longer, but some people actually get some side effects sooner. It's critical that when you apply the drop, you only use one drop at the base of the eyelashes, okay? Not more is not better, okay? If you apply more, it'll get in the eye and have negative side effects, including injection of the conjunctiva and so forth. So you have to be very conservative about how much you apply and where you're applying it. In addition, Vermatoprost can stimulate the hair follicles of the eyebrow. So some people have thin eyebrows, and you can stimulate the eyebrow by applying the Vermatoprost to the base of the eyebrow hairs. So the Latisse brand name of Vermatoprost comes with a set of tiny brushes which you can apply more accurately to the base of your eyelashes and eyebrow. If you go for the generic Vermatoprost, which of course is less expensive, you got to apply it very carefully with a Q-tip at the base of the eyelashes. Again, I can't emphasize that enough. Let's talk about the medical reasons why people would use Vermatoprost, and there are good reasons to use it. There are people who unfortunately have had, say, chemotherapy and have lost their eyebrows or eyelashes. And in those patients, Vermatoprost can stimulate the regrowth of eyebrows and eyelashes. It takes several weeks to do, but it can help regrow those eyelashes. There are many other medical conditions where it's possible to lose eyelashes. For instance, hypothyroidism, scleroderma, autoimmune diseases like alopecia areata. In the case of alopecia areata, where people have an autoimmune loss of hair on their head and their eyelashes and their eyebrow, those cases do not respond to topical Vermatoprost or other eyelash stimulants. In other cases where there's medical reasons why you've lost your eyelashes, say from an infection or from a fungal infection, for instance, it can stimulate new growth of eyelashes, and it not only increases the length of the eyelash growth, but the density of the hair also increases. The third category of things that I want to talk about is the paste-on eyelash extenders. I have a lot of reservation about these particular ways to extend your eyelashes because, first of all, there's chemicals that you need to use to extend those eyelashes. Usually the paste-on chemicals can be irritating to your eye. And secondly, and most importantly, when you put on those long eyelash extenders, it changes the aerodynamic flow of air that reaches your eye and actually can dry your eye out. Okay, this has been shown experimentally that if you put on long eyelashes, and maybe even when you stimulate your eyelashes to grow really long, it can change the airflow towards your eye, and your cornea can actually dry out. So I have a lot of reservation about people who want to use eyelash extenders and paste them on. I think that you should probably try to use the stimulants first, and then only as a last resort consider using the eyelash extenders. The other reservation I have about eyelash extenders is that the glue can actually lead to alopecia, loss of eyelashes, when you take out those extenders and you outgrow them after several weeks. Removing them actually can pull the hair follicle out, and some people develop permanent loss of eyelashes. So it counteracts the aesthetic improvement you expect. Today we've discussed the pros and the cons of eyelash extenders and eyebrow stimulants. I hope this video has been informative so that you can make an informed decision on whether or not you want to do those procedures in order to lengthen your eyelashes. If you have any further questions, please leave them below. I'm happy to answer any of your questions. Please subscribe to my channel, and I look forward to seeing you again in my next video.